And welcome to Dr. Luke on Call, where you get accurate medical information. I'm Dr. Schalk Burger, and it's because of a lack of knowledge that people perish. And today, it's because of a lack of knowledge that you have a nosebleed. And I guarantee you, all the viewers, that there must be at least a good percentage of people sitting with a tissue stuck up their nose with a nosebleed watching this video. So we're not going to go into why you get nosebleeds now and what are the reasons, and we need to know what to do. Let's start straight away. How do you fix nosebleeds and what not to do? That's really important because there's a lot of mistakes people make with nosebleeds. Okay, so if you have a nosebleed, number one, do use a decongestant nasal spray. Now what's that? So any nasal spray that you use for a blocked nose, those sprays are constrictors, vasoconstrictors. They narrow your blood vessels so there will be less bleeding. So you take a nasal spray, you spray it into your nose 4, 5, 6 times on the side that is affected. If you're not sure, you can do both sides, but preferably the side that you know that's bleeding. So that's number one. Secondly, very important, pinch your nose on the soft part for 5 minutes. Repeat for 5 minutes if needed. Now this is really important. People tend to make the biggest mistake here. They pinch the nose for a few seconds, have a look and see if it's still bleeding. So the best recommendation is have someone take out their phone, stopwatch or your watch, and time it. Time 5 minutes on your watch, holding it and squeezing. And then the third important thing is, where do you squeeze? It's important to squeeze on the soft part of the nose, because if you don't squeeze on the soft part of the nose, and the soft part is there, it's not on top, it's on the soft part of the nose. Okay, what should you not do? Do not tilt your head backwards. How many people do this? Okay, the reason why we don't do that, the blood is going to run down the back of your throat, it's going to go to your tummy because you're going to swallow it, and it's going to make you feel nauseous and you can vomit from it. So the best thing is to be upright, standing or sitting, head forward so that the blood can drip out. You don't want to swallow the blood, and the pinching on the soft part of the nose for a minimum of 5 minutes. Do not push on the bony part, as I said. Okay. Do not blow your nose or keep on wiping the nose. There's no purpose in just putting toilet paper or things in the nose and not having pressure on the arteries. It's not going to work because you take them out again. And when you do that, you break the blood clots. When you blow, you break the blood clots. It also increases the pressure. And if you increase the pressure, it will just bleed again. The small little blood vessel that's there needs time to clot, and that's why it needs the pressure. And then last thing is, if you release the pressure before 5 minutes, it will probably bleed again. So wait the full 5 minutes, then check and see. Okay, let's get to the reasons why we get nosebleeds. Important to know, if the nose is dry like in autumn and winter, there will be more nosebleeds. People that get allergies, you will definitely find more because of more blood circulation, more inflammation, irritation in the nose. When you have colds and flu, for the same reason, you will have more risk of nosebleeds because you're blowing and you're wiping and there's more blood flow in the area. Then blood thinners like aspirin or other blood thinners that you can be put on by your doctor for a medical condition can definitely also give you a much higher risk of nosebleeds. High blood pressure could be a cause, so it's a good thing if you have recurrent nosebleeds to have a look at your blood pressure and see if your blood pressure is not maybe elevated. And then also some of the more serious but more rare conditions, bone marrow problems and blood problems. So anything that will affect your platelets or your red blood cells or in your bone marrow abnormalities, more serious conditions. But we'll get to that now because then you will definitely have to see a doctor. So that brings me to the next question. When is it important to see a doctor or a nurse or a primary care practitioner or someone that can help you and if you're not getting the things sorted out? So repetitive bleeding on the same side normally means that there's a specific blood vessel that's very prominent and it needs to be cauterized. So cauterized means you can take electric cautery equipment or you can take a chemical cautery equipment with this little silver stick, and you can burn the tip of the little blood vessel there so that it doesn't keep on bleeding. Then when nothing else helps and you've done the 5 minutes, you've done the 10 minutes, it keeps on bleeding and you may be on a blood thinner, you need to go see the doctor. Like I said, the blood thinners can be a big problem, and it's sometimes very difficult for you to stop it, and it might have to be packed in some cases. Also, if you see that there's a lot of other bruisings on your body, on the person that gets the nosebleed, bruisings under the skin, regular bruising, then there might be a problem with the bone marrow or the clotting condition, and that is a lot more serious, and it needs to be looked at by the doctor. Lastly, if we look at the anatomy of the nose and how the nose actually looks on the inside, in the front part of the nose there's an area called Kisselbach's plexus, or Little's area. That is an area that gets supply from a lot of areas, and there's a lot of blood vessels there. And as you can see, it's actually right in the front of the nose. That yellow line that comes down there, that's the bony part. So where we get the bottom of the bony part, in that area, that's where you get all these little blood vessels. And they are the ones that causes the majority of nosebleeds. In rare cases, you can get nosebleeds from the back, especially in older people, and that needs specialist attention. But the majority of time, you will get your nosebleeds from the front part of the nose, and that is very manageable. You can use your decongestion spray, get it in there to strengthen a bit, get your pressure on those arteries. If there's a prominent one, it might have to be cauterized a bit later. I hope your nosebleed stopped now. I hope you squeezed it for 5 minutes. It might not be quite 5 minutes yet, but practical things, easy to do. Remember, do not put your head back. Do not swallow all the blood. Make sure you get it under control. Make sure you help someone else when they have a nosebleed to do the right thing. Thank you for watching. Stay safe and stay healthy.